The first day that I can recall around COVID was actually March 6th. I got a call early that morning from the governor's office to let me know that the first case of COVID had come to Indiana. That was confirmed. And the individual was actually quarantining in the city of Fishers. And from that moment on, nothing has quite been the same. We really took a pretty aggressive and proactive approach around a couple things. One, being that we wanted to communicate to our residents and our stakeholders as often and as clearly as we could. So we stood up a pretty aggressive communications campaign, not only through social media and typical media channels, but literally conference calls. And we were honest that at most of those times we didn't have a lot of information, but we were candid about the situation and we wanted to keep that open dialogue throughout. And then the other thing was, what services, what are our people going to need in this time of difficulty? Is it basic things like food and shelter and supplies, or is it going to be medical services? What is it that everyone's going to need?
I remember very distinctly watching the Johns Hopkins website and watching those dots kind of take over the world, basically, as the cases spread and slowly get closer and closer to us. As a public health professional, I knew what the next steps would be. I knew that testing would be the next thing on the horizon and that we would need to be gearing up the rest of my public health teammates to provide testing for folks on a massive scale. I remember the prevailing feeling that I had was being impatient because we knew that testing and tracing were the keys to stopping any infectious disease spread. You have to be able to identify who's sick, and then you have to be able to notify people they may have been in contact with who could be sick next.
So imagine in early April, we're hearing messages from the President of the United States saying that COVID has come to our country. People were locked in their homes. There was this fear and apprehension. I would go to work and I'd literally be the only person on the road. And we started searching for the things that we needed to do to be able to meet the needs of our community. One of the things that I stumbled upon was a report from Johns Hopkins about the kind of the fundamentals of public health and the need to identify who's sick and then get them the treatment that they need or have them quarantine. And that type of infrastructure seemed like a very logical path forward, but the problem was there was no easy way for us to accomplish that under the current structure that city government found ourselves in. And so that really was the beginning of our decision to create a local health department.
At this point in the pandemic, we forget how limited the testing was. So in public health, we knew that we were going to be doing testing. We knew that public health was going to be involved, and we knew how to do that. We practice every year for mass events like that. So I knew that the health department that I was working for would be prepared and would be ready to start offering testing as soon as they were able to, but it just felt like an awfully long time before that was able to actually happen. So we were very, very anxious and impatient, I would say, waiting to get started. We were in this holding pattern of kind of waiting to jump into action. It was frustrating because we knew that this is our time. This is when we need to do our thing, and we didn't have the tools to do it.
So back in March of 2020, I was working at the COVID Command Center. It was the first established COVID center in the state. And thinking back on that and what we were experiencing, the one thing that really overwhelmingly comes to mind is fear. I think at that time, there was such a sense of foreboding, like we were stepping into a dark precipice with no knowledge of how to get out. And even though my job at the time was to take calls, and we took calls from healthcare networks, healthcare providers, obviously the community as well, we didn't know a lot. COVID has taken, over the last year, a huge toll on my mental health, if I'm 100% honest. I think for most people who aren't involved with it on a daily basis, you can kind of put it away, right? We can kind of offset a little bit and not think about it. But my job is to think about it. My job is to talk about it all day long, research it constantly, and it's difficult to compartmentalize that information.
My intimate involvement in the COVID response impacted me personally because I had so much knowledge of the virus that I definitely feel like at times it made me more nervous or anxious of being in contact with the virus, especially having a young child. But I would also say that it allowed me to help spread correct information and educate people on best practice and the current trends and things that they could do.
The first few days it was about a 6 or a 7. It was bad flu symptoms. It was later that things got worse. Fortunately, not as bad as many, but it just really after that Thursday test, what happened to me then is the virus sucked all the energy out of me. I felt like doing absolutely nothing. I was fortunate to have enough energy to get out of bed and sit in a chair. That's about all I could do. And I could feel the congestion in my chest. So that's when I felt like things were getting dicey. One more turn to the dark side, and I knew I could end up in a hospital.
On April 11th, I have an email where my city attorney said, hey, food for thought, a second-class city can create a health department under Indiana law. And over that weekend, I continued to think about this more and really saw a path forward on what we could accomplish, and came into work that week and told my team, I think this is something that we should do. And usually I look to my team to tell me whether or not it's a crazy idea or not. And after we talked through it, I think everyone kind of agreed that this was the right path for us to take. And so what is truly astonishing and is really a testament to the folks around me is that in under 2 weeks, we went from that conversation to establishing a health department, and then by the end of the month, administering our first COVID test to our Fishers residents.
I've never been one to shy away from a challenge. I like a challenge. Obviously, starting a health department in a pandemic is somewhat challenging, but I've always been the kind of person that wants to, try to do the thing that needs to be done and to make things better and to, solve problems and find solutions and that kind of thing. And I feel like those were all things that aligned with what I saw happening with the creation of the Fishers Health Department. I also saw a community, my home community, that clearly showed a lot of leadership support and a lot of willingness to take action when most of us in public health were, again, feeling very impatient with the solutions that we were able to offer.
As we entered into the fall and we started to see the numbers escalate, that was a really challenging time for our community and a very scary time. All of a sudden in October, out of nowhere, our testing site just started seeing almost immediately significant increases in the number of people being infected. And that was a time where I think all of us had to make some very difficult decisions. And so our public health department, our public health board made some decisions to restrict actions and behaviors, and that was a difficult decision to make.
I remember there were some rumors of a shutdown, and we all stood at Pure Eatery watching the governor make the announcement.
If you're watching this at home, I'm grateful.
I think we were all in a little bit of shock at first when he made the announcement of a 2-week shutdown. The first couple weeks, really, I spent a lot of time just trying to understand, what this meant for us, both from a health standpoint and from a business standpoint moving forward. The finish line kind of continued moving, and as that happened, we had to make changes and different plans. We ended up being closed almost 2 months. As a result of the pandemic, we changed our business model quite a bit. In the beginning, we were closed completely. Unfortunately, we weren't in a position to pay our staff while the doors were closed, so that carried a lot of weight for us, and we wanted to get open as soon as possible. Pearl Street opened for carryout on the weekends with a very limited menu, and that helped us keep some people employed and keep some bills paid. Fast forward about 2 months, we were allowed to reopen, and that looked a lot different. Our business changed from probably 25% carryout to over 70% carryout after reopening. That's a big change for restaurants.
We also knew that our economy was in trouble, that our businesses were hurting. There was a lot of uncertainty in those early days. And so when we announced the local health department, we also announced a series of economic recovery programs for our local businesses. And that included small loans to local businesses with low interest rates. We pushed back any kind of stormwater payment for a significant period of time. We relaxed zoning laws. All of that was stood up in basically the same time frame that we stood up our local health department. So we wanted to have a comprehensive approach, both economy and public health at the same time, to try to address the issues, the immediate issues facing our community. And as we rolled those out and implemented them, we started then to look at how do we still remain a community? How do we connect with one another? How do we make sure that we're taking care of each other and frankly still finding some levity in a very difficult time? And that's when our Parks and Recreation team really kicked into hyperdrive to go out into our neighborhoods in a parade for Paw Patrol, or doing pop-up events here or there in our community, giving people the opportunity to decorate their sidewalks to win a prize. All of these little things we try to do to engineer to really make sure that people still felt like they were part of a community. This is a three-pronged approach, right? Public health, the economy, and community.
Our lifeline during the pandemic, especially in the beginning, was the PPP program. Without the PPP, I don't think that we would have survived. The PPP helped us play a long game. It was important for us to keep our business open for the long haul. We made that money last as long as we possibly could, which in turn helped us use our revenues to pay the vendors and supplies and all of the overhead that are involved with running a restaurant. So I think the PPP was probably the most vital part. There were some other loans. Fishers gave a loan, which was fantastic. I think people sharing social media posts, liking posts, and being involved in local businesses' marketing efforts is definitely important to us.
In the November, December timeframe, we were hitting numbers of 180 a day. And so you see this exponential growth of the number of people getting sick with COVID-19. Unfortunately, what happened at the same time is people had kind of become accustomed to COVID by that point, and they were tired of all the restrictions. And so you just found yourself with a community that was frankly just tired and fed up of having to deal with this particular issue. But we still had to lead through that because we had information and data that told us, boy, there's an awful lot of people getting sick. And when they got sick, we knew some of those people, unfortunately, were going to perish. And as we sit here today, 95 individuals that called Fishers home have died from COVID-19. So we knew that there were real ramifications if we didn't act and we didn't communicate directly to our residents about the situation that we found ourselves in.
I would say a poignant moment, probably the most poignant moment for me, was the fact that my grandparents both got COVID and went into the hospital at the same time, and my grandma survived and my grandpa did not. He was about a month and a half shy of the first vaccination coming out, so definitely hit hard knowing that he was so close to potentially being protected from COVID.
Our son passed away on March the 20th. He went to work one day and someone got sick. They came in to work. They had like a temperature of 103. The next day, I guess, my son had like a slight temp, so he didn't have any major symptoms. So he went to MedCheck. MedCheck sent him home, told him to quarantine. At that time, they weren't doing any testing, so he couldn't get tested. Within that period of time, things went down very rapidly. All I can still see visually that is very difficult for me to process is I still see my baby FaceTiming me and him crying and saying, "Mama, this really hurts." My daughter-in-law was not allowed to go back with him once they got him to the hospital, Community East. She had to wait in the parking lot. They wouldn't give her any information. They kept telling us that he was fine, he's stable, in stable condition, and he's being admitted to the hospital. By 9 o'clock, now understand I said 5 o'clock, by 9 o'clock my son was dead. People, one, don't still believe that this is real. They don't believe that this can happen to them. And I must admit that I was in disbelief until it happened to us. My baby was 32. Since when does a virus have a respect of person? The stress of all of this can also cause a breakdown within the family. The communication is so important that if you do go through that, it's imperative to get that right. I am so thankful and grateful that we were able to come back from that.
We're now past the first of the year. Numbers are declining. We're into the vaccination mode, and I'm really proud of our team. I mean, when we realized that we were going to have the opportunity to administer vaccines, we were ready to go. And we stood up again a small vaccination site to get going, and then we realized to be able to meet the scale and the need of our residents, we had to think bigger. And we took an old abandoned building and flipped that into what I think is one of the nicest vaccination sites in the state in less than 14 days. And we have the capacity to vaccinate 2,000 people a day, which is extraordinary.
I think that we will all come out of this pandemic learning a great deal, not just about public health and how fragile the infrastructure is, but also how we as humans and Americans behave in a crisis. People now have a knowledge of what their public health departments do, and in the best of times, what we do is we try to be invisible, because if you don't know we're there, then we're doing all of the right things. That means that we are doing the things that are necessary to protect health and to keep everybody healthy and safe. If there's no outbreaks, then we did all of the things that made us successful. If there is an outbreak, then you know that we're there. Hopefully, I think we'll all have learned something, and hopefully we'll be able to move forward in a positive direction and make some positive changes for how we can protect ourselves going forward and build better structures. Look at what worked, look at what didn't work, and modify, and have the ability to modify and not keep thinking that we need to do things the same way. None of us want to be on lockdown again. None of us want to have these restrictions. So if we can use a little more caution and care in our daily activities with the simple measures, then we can make sure that we're able to get through these new variants while people are getting vaccinated and not have to roll anything back.
I think the Fishers residents have done a phenomenal job of adapting to the new normal. I think that at this point, it's a well-oiled machine. I think that people want to be involved, they want to be aware, they want to be vaccinated now. They had access to testing and they were willing to do that. I think that they asked great questions through the COVID hotline. I was very impressed with the community and the residents of Fishers and how they took this thing with so much uncertainty and really came out stronger for it.
I think that I will hug people a little bit tighter and be present so much more, because I realize the one thing that I've missed over this year is time with the people that I love.
I think if we can figure out how to go about our daily lives with a sense of care and continue wearing our masks and washing our hands and maintaining that distancing and using those good practices that we've talked about that really do play a part in preventing the spread. They play the major part in preventing the spread. We can continue to have that that level of awareness and move about into, kind of more like our daily routines. Get vaccinated when your time comes, get tested if you're sick, answer the call for contact tracers if you can. This is the way that we get ahead of this. It just takes a little more vigilance on our part to make sure that we're doing the right things as we move forward.
If I had one request of our residents, I would ask that patience and diligence in the coming months. It's going to take a while to vaccinate everyone. And in that time frame, we still have a civic duty to follow the health department's guidelines, to do what's in the best interest of your family, to keep them safe. And I believe on the backside, we're going to be okay. But in the interim, please continue to be a good member of this community and follow the guidelines and follow the best practices moving forward.